healthcare. Any thoughts on healthcare? I know that one of the things that is in the works is a waiver from for the Affordable Care Act to expand some of Indiana's coverage, doing it kind of Indiana's way. Any thoughts on the health-wise and some of the programs that Indiana has in place?
I think that Obamacare is a disaster, and I think we saw in the most recent decision where the court said state exchanges are state exchanges, and so the federal government can't do what they're doing. They're not going to be part of this. And then Obama has said, no, never mind, that's not what we meant when we wrote the law, which none of us read. So not a fan of that. And I think we've seen how the federal government runs healthcare in the VA system. They've done that for years. They've been rationing, obviously, for years. And clearly those in charge knew that and did not bother to give the care that our veterans deserved. And so you'll see that as they nationalize the private pay system, which is what most of us think of everything other than the VA system is right now. So not a fan of having the government intervene in that way, but they're already involved in Medicaid and Medicare. I applaud that Governor Pence is asking for this waiver to go our own way. I don't understand or know all the details of the program, the HIP program that he's instituted, 2.0 I think he's calling it. But the fact that individuals have to have some skin in the game makes a difference. We do all have to be accountable for our own health care costs and the services that we ask for, and for our own health. You know, that's what President Obama's wife, Michelle Obama, is telling us all. At the same time that they're telling us, they'll tell us how we should take care of ourselves. So I think that's very important. And I don't know how it's going to come out, but I mean, if anybody thinks that the federal government can do it better, they should just go ask those veterans' families who were on waiting lists in the VA hospital, and they'll find out that probably not the best way to run a hospital.